Welcome to the Insync Insurance podcast. I'm your host, Dawn Cross, and today we'll be discussing consulting, safety procedures, and complications in aesthetics. Here today we have guest Agnes an aesthetician who delivers training in her company, Eastderm Ltd. Could you please introduce yourself and what you do in the company?
Good morning. My name is Agnes. I've been in this industry for a very, very long time. I don't even like talking about, how many years, but it's over 20 years. What do I do? I'm the company owner. My company is named Eastderm Ltd. We are based in UK, but I'm also international training provider for CMED Aesthetics and other international companies. And I'm really, really happy to be, to have my company in the UK because as I train all over the world, as I train in different markets, I must say the therapists are really nice in here, and it's absolutely lovely to work with people. There's not so much, drama about things, there's no lot of disputes, and it's a nice environment to work. So I'm really privileged to be here, and thank you for having me today.
Yeah, well, thank you for coming on as well. I know, especially with aestheticians' kind of schedules, it can be quite hectic. So I appreciate the time you've taken out of your day as well. So today we're going to be talking about consulting, safety procedures, and complications. So I guess my first question for you, it kind of be to explain the kind of process with working injections with you. So you were saying before we had a brief discussion about your training and stuff. So maybe you could start off with that.
Yes, of course. If it comes to injectables, there's two very important things. First of all, it's the technique. The technique which we are using when we work with microneedling, when we work with mesotherapy, we need to remember that the knowledge of the skin, that the knowledge of anatomy and physiology is vital. That we don't need to cause too much injury, that we need to adhere to the protocols provided by the trainer, for the company trainer or manufacturer, because they have all the data behind, they have made the trials. So we should not be changing things ourselves, because there is a reason why we should be keeping to those protocols. And as we were talking before, with the choice of the training provider for the technical mesotherapy or microneedling parts, you can go anywhere. But if you would like to use specific product, you actually need to go to the distributor, you need to go to the manufacturer, because they are the only ones who are able to teach you the procedures. So you're going to be covered by your insurance, you're going to be safe, your patients are going to be safe. So when you are doing injectables, when you're doing consultation, you need to take many different things under consideration. First of all, which technique you're going to be using. Are you going to be using nappage, just superficial injury? Are you going to be, how the product is going to be applied on the skin, to the skin, so you would have the best effect for your client, but also the safest effect. And we have to remember that the safety is always the priority. So accurate training, proper training, knowledge of the skin. You really need to know where you are injecting. Why are you doing that? What can happen with the product? If you're choosing the product, do you have awareness of how long those substances are going to be deposited in the skin? If you're injecting fillers, this is actual implant. It's not a mesotherapy. You are implanting something, and very often it stays in the skin for many, many, many years. I have amazing luck to be able to work with the plastic surgeon and assisting with the plastic surgeries. And we had fillers which we had to remove, and they were implanted over 7 years ago. And the patients were not aware that those fillers can still be there. But that's another area, which is going to be regulated. And honestly, I don't have much opinion on that, because I'm not dealing with the fillers. I don't do fillers. I think there are other procedures like mesotherapy which can have absolutely amazing effect, and safe effect. So with injectable safety, if you know the technique, if you've chosen your product well, that's the priority. People are often asking, does the product have to be CE marked? And that's a sort of a gray area. I would say CE mark is very important, but CE mark is going to be changed. That's why many companies haven't applied for CE mark at all. When you're purchasing product, ask for sterility certification. If the company has sterility certification and all the pharmaceutical ingredients, they will be able to confirm that in writing, and you will know that you're working with the safe product. The law in this area is changing as well. And coming to the consultation, I mentioned a little bit about the safety. So of course, knowledge of the technique, knowledge of the product, knowledge of your patient. Consultation is very, very important. I'm using actually, Insync consult form, and you sending the consultation form. I'm always sending medical form to the client, and I'm always sending specific procedure form to the client and post-treatment care. And why those things are so important. First of all, before the procedure, you will be able to find out about any illness, pregnancy, breastfeeding, autoimmune disorders. These are all contraindications to the treatment. If the client is telling you, oh, it's fine, I had this treatment before, would you take the risk? I wouldn't, because you never know with autoimmune disorders how the body is going to react. You can cause cytokine storm, you can cause really bad complications, not because of the product, but because you inserted this needle, you caused inflammation, you caused cross-reaction with the already existing condition. So it wasn't necessarily your fault. It was your fault because you ignored contraindications. So it's not the product or the technique. That's why it's so important. And if someone has, for example, condition as a diabetes, thyroid is very, very popular, unfortunately. Commonly sort of seen condition. If it's regulated, I always ask the consultant letter with the permission to perform the procedure. If I have consultant agreement that I can perform the procedure, then yes, it's a doctor. He decided that I can cause this injury. The patient is covered. I'm covered. That's the most important. All other conditions, where is someone working? It's all in the consultation form. Where are they working? What are they doing? What job are they doing? Are they going to go to the factory in the evening after you perform the procedure? Yes, very good. But you can expect infection because you caused so much injury on the face or on the body. It doesn't matter where you do the injectables. Pathogens are going to penetrate. Again, it's not going to be you. It's going to be contraindications to the procedure. So fill in those forms, spend 20 minutes. I know it's a lot of time for the consultation. Always ask about medication. There are photosensitizing medication. I've got the whole list. There's over 70 photosensitizing medications, and I have this list actually on the wall because I don't remember all of the medications, but it's really good to have it just to check it, because then you are going to choose the pill, which is, for example, not photosensitizing, which is not going to cause reaction with those medications. You're going to choose the products which are not photosensitizing. So it's all needs to be thought through. It's not a quick process, but it's absolutely necessary for the best results. And next thing, is your patient able to purchase post-procedure products? If not, do you really want to do this treatment? Because what they have at home can have really bad complications. I had a lady who had a procedure recently. It was a chemical peel procedure, and after the chemical peels, someone is leaving the salon, and you would see there and now if the complication happened. And the complication wasn't my client, it was just a consultation, but the complication wasn't there. And it appeared 48 hours after. Quite bad burns on the face. And you need to know, even if the client tells you, oh, I haven't used anything, you need to know your science, you need to know your chemistry, and you need to know that if you apply the peel, if you do the peel, and then the client applies the product containing retinoids at home, the complication is going to appear up to 72 hours after the procedure. But it's you who need to know that. So you need to inform during the consultation the client what they can, what they can't do. They need to sign it. You need to give them extra note to take home, because people forget. Also ask about antibiotics. There was a case when the lady she was my student, and she said, Agnes, but I did ask about the medication. And I said, and what did he say? He was actually having, problems with breathing. We were on the phone all the time. And was like, no, there's no medication. He doesn't take anything. I said, give me the phone. And I asked him, do you take an antibiotics? And he was, just amoxicillin, but it was for my tooth. And it was, so for him, it was a dentist who gave him a tablet. So it wasn't medication. I didn't quite understand the thought process, but for him, it was prescribed by the dentist, so it was fine. It wasn't medication. So be specific in your questions. So we knew what to do then, but be very specific in your question. And it was very simple treatment. It was just application of salicylic acid, and the reaction was horrid, absolutely horrid, because he was taking a high dose of antibiotics. So consultation is vital. I can't imagine any treatment without proper consultation.
That's absolutely fair. No, that was really thorough as well, because I'm a person outside the industry, and I didn't actually realize how much you really do need to make sure that they understand what they're going through, but also to double check everything, because things could react with each other, or it can have a negative impact. So it's really good that you guys are thinking about that kind of thing, because me personally, I wouldn't even think about that, or how
you just go for the procedure and that's it.
Yeah, no,
that's why I don't call any of my treatments procedure. Is a skin transformation, because transformation involves the whole process. So we talk about the diet, we talk about the lifestyle, we talk about what you're using before, what you're using after. We talk about how long you're going to be using it for, because if you don't have to know that you might need 5 procedures to have the best results, and probably you don't know that if you start doing those procedures, you're going to love it so much you're going to continue for the rest of your life. But to keep the good skin, you actually need to go to see the therapist at least once a month. So and that's it, for the lifetime.
That's completely fair. Okay, so moving on slightly, I did have a question, but I think you've absolutely smashed that, is why is it important to have safety procedures? This may seem like a silly question, but I'm thinking about those maybe kind of just starting out in the industry or budding estheticians that might really want to get out there, and I'm hoping that some of these episodes will help in our podcast. So I guess, if you have any other knowledge, why it's important to have safety procedures, because I think you've mostly covered it, but
no, it's always, there's 2 things which can happen, and I'm going to just touch base on the training. For me, the main safety procedure is the good quality training. I mentioned that before. I was absolutely shocked when I had seen an academy offering training in the protocols which I wrote, which I provide, just after watching the Zoom webinar. It was, the product knowledge. It wasn't technical, but they started offering the training, which is, if they're brave enough. But I don't think that should be happening. That's why we managed to ensure that all our trainings are trademarked. It's all legal documentation now, so every single product I'm using, for how long you can keep it, who can use it, when can use it, it's all trademarked, it's all legal document now. So you can't just watch it and do it, because you feel like it. But why am I talking about the training? During the training, you are going to be taught how to do the consultation, which I mentioned, why is it so important. You're going to be taught another important thing, how to recognize which procedure to choose, because every skin will need a different procedure. I haven't seen 2 patients on which I would do exactly the same procedure. It's, again, consultation, the lifestyle, what they do, how they're planning to approach this skin transformation. So you're going to be taught how to deal with certain problems, such as, patients with psoriasis or clients with psoriasis or dermatitis, rosacea. It's quite difficult to deal with, well, if you don't know how, of course. And the last thing which you are taught is how to deal with complications. Because as I mentioned before, I am not doing certain procedures, because if I'm unable to deal with complication, I shouldn't be doing it. I don't want to send anyone to the doctor. I don't want to send anyone to another therapist. I don't want to send clients worrying that, give me 5 minutes, I'm going to find out what to do. No, I'm going to know what to do, and I know what to do, and I ensure that those complications, which can happen to everyone, only if you don't do any procedures, you don't have complications. If you don't have any patients, you won't have complications. But if you're working, there's always something which is going to happen, always, even little things. But you need to know which product to use, how often to use it. Do you need to see your client? Or maybe you can just, tell them which product they should be using. Because remember, they have to have products at home. You always should be including, I don't know whether you include it in the price or you just ensure that the client purchases it from you. And I hear so many times, but our clients don't want to purchase it. They go to Boots and buy something. So of course, they can do that, but those products, which are bought off the shelves, very often they're the reason for the complication. And you haven't given the right post-product treatment to your client, so you are reliable for those complications. You shouldn't be doing the procedure if you know that they might be cross-reaction with the product they use at home. But if you give them all the right products, and if they phone you and say, listen, I think I've got a little bit of a burn, or I've got a little bit of inflammation, you tell them, use such and such product 2 or 3 times a day, and it's going to work. So this is very important.
No, that's completely fair. And it's, I think it just sounds like it's like a whole different kind of knowledge base you need to build up, really, as well, isn't it? With even just down to, making sure to, you can think of the right product to recommend.
Yes, of course, but it's something you must know. If you deal with the human being, with the face, with the skin, you need to know it all, because you don't go to the cardiologist and he says, okay, I will do the scan of your heart, but then I'll send you to someone else to read it. Or if you have a complication, maybe I'll send you to a different hospital, because I have a bit of a knowledge, but I'm still not there. And it's the same with the skin. You cannot be not there. And we always offer support to our students, because I understand that it's a lot of knowledge. It's a lot of knowledge which needs time to be absorbed. That's why we have the group on Facebook. That's why people are able to message me. Of course, during the night time I get messages, but I'm not answering them because I still need my sleep. But we do have the support group, and I do support my students for the first 2 or 3 months until they build up this knowledge. If they have complication, this is the time when they can always phone me.
That's really good. And you said you've got so many years of experience under your belt, so your knowledge base must be absolutely expansive.
Well, we learn all the time, but I absolutely love learning. So I attend webinars myself. IMCAS Academy, I'm there every single day basically. And I do recommend people to sign up for the different training with different webinars, different websites. I do recommend reading PubMed. Absolutely amazing resource for the skin science. Read about the products you're using, what exactly they do, how they behave in the skin, what reaction you can expect, how long they're going to stay in the skin. This is so important, and this will build your career. This will build your person as the expert in the field. Expert, I don't like this word, because I don't think we can ever be calling ourselves experts. We learn all our lives, but that will give you knowledge to perform safe procedure. And if you want to be the trainer, if you want to do training, it will give you the tools where you can pass this knowledge to your students.
That's absolutely brilliant. And I think that's so key as well. You need to keep learning no matter what. Something new might pop along as well. So you can't always just be like, oh, so this is it. So I think moving on to our last question, you've spoken briefly about complications occurring and stuff like that. Could you maybe give an example of two of a complication and how best to work with it?
That's a very difficult one because, every single complication is a different one, honestly.
Of course,
it will depend on the person, it will depend on the skin. I will tell you what to do when you have a complication. First of all, you must have, when you're contacting your insurance provider or when you just want to provide the help, you must have your notes, you must have your consultation form, because then you will be able to see, okay, this person works in such place, or maybe they work outside, or maybe they have taken this medication, it could have caused reaction or something might have happened. So your consultation form, pictures before the procedure and always after the procedure, because quite often, very often, clients, I call them patients, clients don't remember what they did, what they didn't have on the skin. So you take the pictures before, you take the pictures after the procedure, and then you're able also to show it to your insurance provider. Listen, they complaining that they had, and that was actually the case, the lady complained that the procedure caused scar on her face. And it wasn't quite possible, but she was actually going for the sue, and that this practitioner phoned me and she was like, what do I do? I did mesotherapy, maybe I did cause this. I was like, first of all, send me the consultation form, send me exactly which protocol you have used. I know she trained with me, so I didn't ask her for the training certificate. And send me pictures before and after. And she sent me the pictures. The pictures were, luckily good quality. And I said, can you just make it bigger? And the scar was really visible there. So the scar was there before. The client didn't remember that, it was a little scar, which looked more like a line, but it was actually a scar. And the client thought, that the procedure, caused this scar. But doesn't matter if it's just a client not remembering that they had certain, scar or problem on the skin. It could be, for example, with the chemical burns, and you would be really surprised when I ask the practitioners, please send me, I always ask the same thing, send me the consultation form, send me which procedure, which product you use, the number, batch of the product, so I know where you purchase it from, because if you're purchasing off eBay or Amazon, I'm not even going to talk to you. So many fake products. Why would you risk it? And send me the post-procedure product which you asked for the client to use. And very often this is where the conversation ends, because they didn't do any of that. So I said, you need to realize that I'm here for you, but if you don't do it everything by the book, I can't help you. And definitely insurance companies, they're not going to even look at you, to help you, because you didn't follow the procedures. So with the complications, have all the documentations and know how to deal with them. That's all.
No, that's completely fair. And especially in terms of your insurance, it's really good to have that kind of paper trail and evidence that, like, yes, we spoke about this and here's before and after. And very key to remember for anyone that's listening is to definitely make sure you have the right paperwork going on. I guess like an additional question is there any kind of tidbits of wisdom you'd like to share before we close the episode?
Love what you do, be passionate about what you do, and always learn. Don't think that going for the training, that reading books, that reading articles is a waste of time. It will only expand your horizons. It will only, improve your knowledge, improve the safety, and don't try to do everything. There's so many clinics who are trying to specialize in everything. Choose what you do the best. What would you like to do, and become the specialist? Because what I'm missing on UK market are the specialists. I know if I would like to do the protocol with mesotherapy, with the skin improvement, I'm going to go to this clinic or such clinic. If I want to specialize if I want to do, Russian lips, I'm going to go to this person because they only specialize in that. And it seems like everyone is doing everything. And I know it's money, but maybe in the long term, maybe with the coming changes, you do want to become an expert in a certain field. And this is the path I have chosen. And honestly, I can recommend it.
That's absolutely brilliant. Well, thank you so much for coming on today.
Thank you for having me. It was absolute pleasure. And all the best, and have a wonderful day, everyone.
Thank you. Thank you to my guest today, Agnes Kuzniak, for sharing her views on consulting, safety procedures and complications within aesthetics. Don't forget to visit her website on www.asterm.co.uk to learn more about the aesthetic masterclasses she has to offer. I have been your host, Dawn Cross, and tune in next week for another episode. Insync is one of the UK's fastest growing insurance providers, offering comprehensive cover for SMEs and the self-employed across the UK. Our expert team can tailor your insurance to meet your individual business needs and compare prices from our Lloyd's of London approved partners. We offer a 5-star service and have been FIFO Platinum Trusted winners 3 years in a row.